Good morning. This is Debbie Hart. I'm the President and CEO of BioNJ, and I'd like to thank you for joining us today for our webinar on strategic communications in the age of COVID-19, complex messaging, diverse audiences. So I sincerely hope that everyone is safe and well, and that we can all stay that way. So we are delighted to have a very knowledgeable group of experts with us this morning who will discuss communication during an unprecedented global health crisis. As we know, when crisis hits, communications professionals are called upon to jump into action. This, however, has been an ordinary crisis, and given these uncharted waters and unprecedented times, it's important for us all to have a thorough communications plan that will answer questions, inform stakeholders, and position your organization as a leader. And I'd like to do just very quickly a shout out to the industry. I have just been bowled over, and so I'm so proud of this industry that has stepped up in extraordinary ways at an extraordinary time, whether it has been taking care of your employees, whether it's been making contributions to important causes, whether it's been keeping your own clinical trials and other operations running at a difficult time, and also for something we didn't even know about several months ago. Many of you have reached into your toolboxes and have come up with potential therapies, cures, diagnostics, etc., to combat COVID-19. So just a huge shout out. And I know I speak for the whole world when I say how grateful we are. So speaking of special people and companies making a difference, we are very fortunate that we have 3 such companies with us this morning and experts to share their very real and very recent case studies. So our hope is that you'll leave with best practices that you can immediately incorporate into your own crisis communications plan. Once you've heard from all the panelists, they'll be pleased to take your questions. So first, I'd like to thank BioNJ's market maker and preferred level members who are making our Business Unusual webinar series in the age of COVID-19 possible. There are many of them, and they are showing true leadership and support during a difficult time, and we thank them. Before we get started, just a little bit of housekeeping. So this is a listen-only webinar. We encourage you to submit questions via the dialog box on your computer screen. We have literally the largest group we've ever had for a webinar on the line, and we'll try to get to as many of your questions as possible at the end of the presentations. If we don't get to your questions, we promise you that we will follow up with you after the webinar with those responses. There will be a recording of this webinar on the BioNJ website at the latest tomorrow, and you can find that at bionj.org. So now let's get started. It's my pleasure to introduce longtime BioNJ member and communications guru with more than 25 years of PR experience in the life sciences industry specifically, the CEO of JFK Communications, Mr. John Cooten, who actually brought us this idea, and we appreciate John, obviously a popular choice. We'll set the stage and moderate today's discussion, so please, John, take it away.
Thank you so much, Debbie, for that kind introduction, and it's great to be with you, and a warm welcome to everybody who registered for this morning's webinar. So as Debbie said, it's my job to set the stage, and I wrote a blog about a month ago in early April about setting a positive tone and positive leadership communication under pressure. And it touched on all of these concepts that we're going to be discussing this morning as it relates to strategic communication in this era of COVID-19. So just a quick snapshot and a reminder of how quickly this all happened. January 20th was our first reported case in the US. February 6th was our first death. And if we pick an arbitrary date, say March 7th, we were only at 20 deaths in the US. So here we sit on May 7th, a short 62 days later, and we're at more than 260,000 deaths worldwide, over 70,000 deaths in the US. And so we are in the midst of this unprecedented crisis, and I hope to report that this is the most significant crisis any of us will ever experience. And we're looking for the right vocabulary. Our partners come to us, and Debbie mentioned I have 25 years in the life science industry, and I'm so proud to say that all those years were spent here in the great state of New Jersey. How do we, as a life science industry, set a positive tone? How do we communicate to our key constituents? And this slide talks about, employees and customers, patients, and different constituents, shareholders and investors. What's the right vocabulary? How do we communicate during this time? And I'm hoping that we touched into a good topic because we have so many folks that decided to join us this morning. So we'll be covering some of these concepts and case studies and best practices. And one of the things that I always focus on, and it's been a best practice, is setting a positive tone. The leadership that I've seen by companies who are in this life science ecosystem, especially here in New Jersey, they are poised, they are calm, and by this poise and calm, they instill confidence and trust. Because these constituents, and anybody, by the looks of everybody that's on this call, on this webinar, if you've been in the life science industry, you've seen your fair share of issues. And we know that issues cause our constituents to feel uncertainty and feel fear, and they have questions. And this pandemic is really takes us to another level of need to respond and need to be prepared to respond. And so that's what some of the things we're going to be talking about. Next slide, Aaron. So implementation is critical, and we talk about take action, we talk about listening and repeat. And we're going to hear a lot today about planning, and hopefully if any of you don't have a plan by this point, by the end of this webinar, you'll be on your way to producing a plan. But it's vital in order for us to communicate strategically. It's easier to be calm and be poised if there's a plan in place. Having a plan in place enables us to fine-tune that plan. If you don't have a plan, you can't change your plan. So having a plan in a crisis situation is vital so that we can know what the team is, so that we can assign roles, so that we can keep that team up to date on things that are going on throughout the length of the crisis. And one of the things another concept that we're going to be talking a lot about is speed and timeliness, and addressing immediate concerns first, especially bad news. It's always better to be out in front. As we social distance, we're all challenged to stay connected. And so what we need to do is we need to make sure that we don't get bogged down too much in waiting and silence. A lot of our constituents need to have a consistent cadence of messaging. So, as a member of the life science community and working with all of you for so many years, we're hooked into data and we're hooked into analytics, and obviously we cannot shoot from the hip when it comes to something this important, but we also don't want to get paralyzed by analysis. And so it's okay. One of the things you'll hear is it's okay to say I don't know, especially to employees and patients. We will look to find the answers. I am humbled to be working in this industry. Our firm represents a variety of different kinds of companies, from big to small pharma to biotech. One of our largest clients is based in Italy, and at the time, they weren't aware, neither were we, that they were going to be one of the global hotspots. And as we were developing our messaging, we realized that we needed to respond to some of the needs, not only of the employees and the patients, but also just the citizens. And I've watched this industry respond with corporate social responsibility activities, charitable activities, and that comes through leadership. And it also, and I'll finish by saying, listening is vital as you move through a crisis, especially COVID-19. Things change. The messaging that we helped our clients with back in February and March is different from the messaging that we're managing today. Today we're really involved in how are we going to return to a new normal, and how are we going to help our constituents move through as the economy turns back on. So this COVID-19 crisis, until there's a vaccine, we believe we should anticipate that challenges with regards to COVID-19 will continue, and we should continue to listen. And so I hope I've done an adequate job of setting the stage for this morning's discussions on kind of where we have been and where we are and where we're going with regards to strategic communications. And with that, I would love to introduce our first panelist, who has over 20 years of experience in creating, implementing, and managing both internal and external corporate communication strategies in the life sciences industry. She joined Genmab in March of 2019 as Corporate Vice President of Investor Relations and Communications. Welcome, Marisol Perron.
Hi, John. Thank you. And thanks to BioNJ for having me here today. As John noted, I head IR and communications at Genmab. And just a few words about my background as it relates to crisis management. I've certainly seen my fair share of them. So anything from product recalls to vaccine shortages to incident management. And I think, as John noted, this really is unprecedented. So we're all living through this pandemic and the communications that surround it. And I'm looking forward not only to presenting to you, but also to hearing from the rest of the panelists. Next slide. So just a little bit about Genmab to level set maybe how we're managing the crises. Genmab is a biotech leader in developing antibody medicines for cancer. We have a strong track record. We have 3 products that we created that are on the market. And we have about 600 employees in our headquarters in Denmark, our R&D center in the Netherlands. And we have about 160 employees working remotely right now in New Jersey, but soon, once we're able to go back to work, we'll have new brand state-of-the-art offices and labs in Princeton. So we're looking forward to eventually moving there. Next slide. So today I want to share with you how we designed our crisis management plan, and then also the importance of thinking globally and acting locally, and vice versa, because the messages do need to be tailored to employees based on, of course, the countries and the various dynamics that are taking place with the pandemic in each individual site. And lastly, share with you what has worked well through the pandemic at Genmab. Next slide. So as Debbie noted, when crisis strikes, communications is usually first at the table. So that certainly happened in our case. And also in crisis strikes, this is not the moment to start drafting a crisis management plan. So hopefully all of us communicators have something already in file, in the can, that we could quickly open, dust off, and tailor to the needs, because certainly starting from scratch is going to put us way behind. So in particular for Genmab, I did have something that has worked for me in the past, and you can see it in this slide, but we really started with monitoring, and that started in February. Especially our leaders in Europe started tracking much sooner than I think some of the companies here in the US. And by the last week of February, we really had already established our response team, and really also established that they would be the primary source of information for Genmab. The other point that I'd like to make is that a crisis management plan is only as good as its leadership. So we really need to have strong leadership and clear governance and roles. And luckily at Genmab, we have really a fantastic CEO who set the tone and the direction for how we were going to manage the crisis. And as you can see in the slide, we monitored and we followed the guidance from the World Health Organization. We evaluated the impact to employees, to the business. Then we moved on to really activating our resources and defining scenarios that would trigger decision making, and then communicating clearly and often. And this really has become a loop that we continue to follow today, because every time something changes, again, globally or locally, we need to go back to that monitoring and adapting. Next slide. I also mentioned the importance of thinking globally and acting locally, and then the reverse to that phrase, because we started following directions from the World Health Organization, and at the beginning that was very much aligned to local authorities. But then we quickly realized that we needed to monitor what was happening in Denmark, what was happening in the Netherlands, and then adapt our communications, our global communications locally. So in Denmark, for example, where we're headquartered, they were among the first countries to shut down, and then also now among the first countries to have reopened society. So we've been having to make sure that all our global messages resonate with employees, but that also we adapt our messaging locally, following every single health agency in the Netherlands, in Denmark, and of course here in the US and in New Jersey specifically. Next slide. Now let me share with you some of our efforts that have worked well during the COVID-19 pandemic. First, from an internal comms perspective, and I won't go too much into this because I know others on the panel will be delving a little bit deeper, but we did have our intranet that we launched really over a weekend, and that became a central place of information for all COVID-related activities. So we created special pages, CEO messages, videos, Q&As, and that was housed there. From an event planning perspective, this really was a little bit more challenging. And as an example, we had our annual general meeting for our shareholders in Copenhagen at the end of March. And this is a mandatory legal requirement, so not hosting it or pushing it really was not an option. And it required quite a bit of communication to the board of directors with various scenarios, to our shareholders, and really had to quickly turn what had historically been a local live AGM into a partially virtual meeting, still holding it, allowing our shareholders to go, but also making sure that we were obeying social distancing and that we offered a web solution so that our shareholders would be able to still participate in the AGM. Two additional elements that have worked really well for us are our efforts related to employee engagement, and then our efforts related to CSR activities. So on the next slide, you'll see that we really try to harness kind of the strong culture, which we're very proud of at Genmab, and really make sure that we were really worried that we would be in a position where remote working would kind of really threaten that special culture that makes Genmab so special. So we quickly turned from the day-to-day crisis management communications to a phased approach where we identified small wins, like having our CEO do videos on a weekly basis, to leveraging our technology, and then activating our employee resource group, which is called the Gen Clubs. And we really allowed them to go all out and develop various activities that they could then help us connect, engage, and inspire our employees. On the last slide, beyond the internal response efforts to ensure the safety of our employees and mitigate the impact on the business, our leadership and employees really quickly pivoted to how can we contribute. And in general, I think as an industry, Debbie mentioned this, we've done really a fantastic job, and we should all feel really proud to be in life sciences. What has worked well from a CSR perspective is also that it's not only the right thing to do, but it really helps build the pride in employee morale as well. So, we certainly did our share we started a matching gift program to the New Jersey Pandemic Relief Fund, and we've donated PPE supplies from our labs. So in closing, I think just the importance of having that crisis management plan, super critical. The importance of thinking globally and acting locally, and tailoring that message to employees. And then really harnessing the power of your corporate culture with your employees through CSR efforts or other activities. I think really once we're able to go back into the office, these efforts and how we responded to the COVID pandemic will really make us that much stronger when we're back in the office. So with that, I'd like to close. And again, thank you so much for the opportunity.
Thank you so much, Marisol, for that presentation. And just a reminder to all who are listening in on this webinar, we will be taking questions at the end. So please type them into the question box, the chat box. So next, I'd like to present our next presenter with more than 25 years of experience in human resources, organizational development, corporate operations, and building life sciences organizations. She's the Chief People Strategy Officer for Insmed. Please welcome Nicole Schaefer.
Thanks, John. Next slide, please. Good morning. It's a pleasure to be here. I've been at Insmed for almost 8 years and lead a variety of functions, as John mentioned, including human resources, IT, facilities, and just before going from work from home, I was asked to lead corporate communications. Sort of ironic. But like everything else, it's been a learning. And most importantly, I have a wonderful organization and an amazing team who works exceptionally well together and has managed and executed largely everything that I will speak about today. Next slide, please. So, who is Insmed? We're headquartered in Bridgewater, New Jersey with a global footprint. With over 450 employees, we're focused in rare diseases and small patient populations. The first product that was developed from concept to approval by Insmed was approved in the US in the Q4 2018. We're working on approvals outside the US and have a robust pipeline in development. We have a US field force and employees in both the EU and Japan. Next slide, please. We've always been a very relationship-driven organization that's relied heavily on face-to-face communication. But more recently, as the organization has grown and globalized, we've had to become more formal about our communication channels. In an effort to cover a variety of audiences on today's call, I'm going to touch on 3 that are key for Insmed: our employees, our patients, and our board. The executive committee aligned early and aligned on the message that we wanted to provide to these key audiences. We, of course, divided the responsibilities, but the messages were consistent. If we follow our values and mission, we would continue to be true to what has made us the organization we are today and would ensure our continued success. If we took actions that protected our employees and our patients, everything else would fall into place if we followed this North Star. We agreed to be transparent with all the audiences, letting them know that while we didn't have all the answers, we would continue to communicate often and using a variety of channels. Next slide, please. Japan was the first location where we made the judgment call to work from home, followed by our EU locations, and shortly thereafter headquarters in the US field at the same time. Even if states weren't issuing stay-at-home orders, as our call points, our pulmonologists and infectious disease docs who are dealing with COVID on a daily basis, we knew our best course of action was to allow the docs to focus on their patients and keep our employees safe and out of their offices. We focused on several key messages and then found multiple ways to deliver them. It was clear that our employees were scared for their jobs, worried about their families and loved ones, and were concerned for our patients. So we were clear in our communication to everyone about how we were handling the field and our patients, our lab employees, and about how we wanted our employees to focus first on their families. In addition, we were transparent about how we were handling the service employees that had become part of our headquarters family. Keep in mind, we had just moved into a new headquarters family in November of 2019, and we're still getting to learn our way around the building when all this happened. The executive committee ensured we took a leadership approach in communication, starting with our own team. We start every executive committee meeting and staff meeting by asking our employees, how are we doing? We take time at the beginning of each meeting to find out about people, how they're feeling, and about their families. And always asking the question, what can we do to help as an organization? Making sure we're over-communicating now both company and individual accomplishments during this time. I think while we've always taken the time to recognize our employees, it's even more critical to do it now more frequently than we had in the past. We then incorporated a variety of communications means that weren't always as robust as they are now. Thankfully, our IT infrastructure is amazing and supported all of this immediately, and we were able to transition seamlessly into a virtual organization. We instituted bi-weekly global town halls, and two of my favorite new programs that I want to touch on are executive committee videos and our virtual connection roulette. So weekly, each executive committee member is recording a video and it's being posted on our intranet. We've relied heavily now on our intranet to share information. And each executive committee members chatted a little bit about what's important to them, how they're managing during this challenging time, balancing the work and the home life, and a little bit about what's going on in the business. The second program is a virtual connection roulette, and that program is an offshoot from our lunch roulette that we were hosting at headquarters historically. Now we're allowing employees to opt into the program, and they are creating Zoom meetings throughout the globe to get to know people that they otherwise wouldn't have been able to. There's others listed here, but for the sake of time, I won't review them all. Next slide, please. So our patients, our first approved product to treat is a disease called refractory non-tuberculosis microbacteria, or NTM, which is a lung disease. And our patients are some at the most at risk for COVID, as their lungs are already compromised. We have a robust patient support program, and our IT infrastructure is developed so that we can support this group regardless of where our case managers are sitting. We ensured we had additional outreach during the time to the patients who had opted into this program. We also quickly recognized it wouldn't be business as usual for any new patients that were going to receive a prescription and require training. You see, our therapy is a drug device combination, and such requires training on the use and cleaning of the device. Our commercial organization quickly pivoted to find means to train our patients virtually. And also keep in mind that our patient population is also more mature, so aren't as typically as technology savvy as let's say, a 20-year-old patient. Regardless, we've had some good early success with this virtual program. And most importantly, through this patient program, we've provided yet another means of support and communication during a very trying times for these even more isolated individuals. We've let them know that what we're doing for them, for our employees. We've received very positive feedback from our patients when they speak with our case managers. One example is a patient said something along the lines of being very glad that Insmed's taking care of its own people along with its patients. That's a sign of a company that really cares. One thing we learned when we were speaking, and where Marisol talked about corporate social responsibility, is we were speaking with one of our healthcare providers who mentioned that their COVID patients were having trouble connecting with loved ones and that devices would help. We were able to identify many iPads that we had that weren't currently in use. And as you may have seen through the call to action with BioNJ, we partnered with them to solicit support from others in the New Jersey area to help with connecting patients with their loved ones. Next slide, please. So another key audience we needed to ensure that we increased our communication with is our board of directors. Our board has been incredibly supportive through all this. They have been informed and aligned with us every step of the way, from pulling our sales force out of the field and knowing the impact that would have, as well as our decision to keep everyone working from home. To ensure they're appropriately aligned, we've increased our touch points. Our CEO and chairman has had increased conversations with our lead independent director, as well as our committee captains. Each executive committee member, there's an executive committee member that's assigned to each of our board committees, and we've affectionately dubbed them as our committee captains, and we've taken the opportunity to increase our touch points with the chairs of each of these board committees to make sure they're also in the know about what's going on. And as Marisol talked about preparing for a virtual shareholder, or conducting a virtual shareholder meeting, we are going to be conducting ours next week. We've always shared with the board about what's on our mind and how we're going to tackle it, but being proactive now more than ever has been critical for us. Next slide, please. So what have we learned from all this? Our employees have appreciated our transparency, that we are acknowledging their feelings and that we've allowed our employees to put their families and their family needs first. They've appreciated that we have taken the time to ask, how are you doing? While this whole situation is scary and overwhelming, it has created new means for communication for us. The challenge will be to make sure we continue to capitalize on these as we move back into whatever the new normal looks like. Now, as we turn our attention to when and how we return to the workplace, we know that fear and anxiety will increase, so additional communication planning will be needed. We've started the dialogue with employees and have highlighted that we don't have all the answers yet, but that we're working through a plan. We have informed them of the membership of a return to work task force so that they may share their ideas and concerns with the appropriate members. We've made the commitment to communicate the plan and have started to already reinforce this through multiple channels. The most important message is the voluntary nature of the return to the workplace plan. Again, our North Star here will be our mission and our values, and we'll continue to put our employees and patients first as we navigate back towards a new normal. Thanks for your time today, and I look forward to taking your questions.
Thank you so much, Nicole. We really appreciate that. So next up, our next presenter oversees employee communications and engagement, social media, and digital content across all of Sanofi US channels. It's my pleasure to welcome Head of Internal and Digital Communications for Sanofi, Lolita Verney Acosta.
Thank you, John, and thank you for using that pre-quarantine flattering photo, because today's would be much scarier, as I'm sure everyone on the line can relate to. Next slide. So I'm going to try and cover off on a couple topics that haven't been covered yet, but the good news is nothing really sticks out. I think all of us really have been doing a lot of the great same work in making sure our employees, our patients, and all external stakeholders are aware of what we're doing, how we're doing, and what we're doing to help in this crazy, crazy time. I just want to give a shout out to the people you see on the screen. They are our critical workers across the country, including in New Jersey, who have been coming into work every day to make sure that our patients are getting the medicines that they need. So a quick shout out to them. Next slide. So Sanofi is a really large organization. We are headquartered in Paris. We have probably offices in every country. In the US alone, we have more than 12,000 employees, a few thousand here in New Jersey. But we are in the middle of not only keeping our patients getting the medicines that they need, because let's face it, COVID doesn't stop all the other conditions that people have, but what we're also doing is working on vaccines to combat COVID-19. We're working on therapeutics for critical patients with COVID-19, and we're also working on diagnostics. So, you know, people have been saying that there's so much that we can be doing. We are literally on the front lines across multiple states working on hopefully what will help us alleviate COVID-19 soon. So the challenge with having so many different employees still having to come into work, but also moving such a large workforce into a work from home situation was definitely something that none of us had probably ever dealt with. So next slide. Employee communication. How do we inspire, engage, and mobilize so many people, right? Next slide. So rapid. I think we've all said the same word. Quickly, rapidly, communicating frequently, fast. And the only thing I would add to that is, yes, speed was of the utmost importance, but I would say we had to be rational, right? It's in the crisis situation, it's really easy to get caught up in the chaos and the crisis, and we needed to take also into consideration that people were getting information from every angle, news, family members, local communities, local governments, and so what we wanted to do was aid in that information and make sure that people were getting the most critical and credible information. So because we are headquartered in Paris, we stayed very closely aligned to our global crisis team. but also made sure to stick to CDC guidelines for our own country. The next step was to identify those business critical employees that we needed to have continue safely working to manufacture those medicines, to continue those trials, and to help battle COVID-19, but at the same time identify those non-critical employees so that we could keep those critical employees safe, because social distancing was of the utmost, and still is, of the utmost importance. In total, over the last 2 months, we've developed and sent out hundreds of communications to the country and to individual sites. Again, each site had to have something tailored based on their local guidelines. That included leadership message, how do we handle COVID confirmations and positive cases and sanitization in every different building that we have. How do we keep employees aware of how to get into the office when there are quarantine mandates in place? And how do we keep them safe once they're on site? All of those needed to be communicated. They needed to be communicated quickly and effectively. So I don't think anything really sticks out about how we did it. There were the direct and frequent emails, there were the newsletters, the Zooms. I'm sure everyone is so happy and sick of Zoom at the same time, but it has been a lifesaver in keeping us all connected. Weekly video messages from leaders, intranet being the only one-stop shop where people can go and get information whenever they need it. Keeping close to our CEO and our executive committee in Paris and in other countries. Updates on what our company is doing. I think it is so inspirational that not only have we continued to make the medicines for people with diabetes and rare diseases, but we've really put everything on the front burner to try and help this pandemic. And then the last thing here is we launched a gratitude campaign, and it aligned with our global company, with Sanofi acts as the global campaign. If you go to the next slide, it's a little bit of a visual representation. I think what we've all seen is in times of crisis and in times of chaos, people band together. It's human nature. And so Sanofi acts as our gratitude campaign. We wanted to give employees a way to express themselves, a way to give back. So we launched this intranet portal and we created a call to action. We asked employees to send in videos, words of encouragement, thanks, not only to the frontline workers, the doctors, the nurses, the fire, police departments, but our own employees who were working 24/7 on all of the topics I mentioned before. We housed all of those messages and videos in one location. We are constantly getting new additions. We feature them across our social media channels, but most importantly is we make them visible to the employees who need to see them. So we have those positive messages displayed in locker rooms where those people gown up and gown down. We have them playing on digital screens. We have them stuck on posters so that we can keep encouraging and showing people how much they really are doing to help us during this time. One of the great things is we're also letting people showcase the best of what they're doing. So people are sewing masks, people are donating their tech skills by creating apps so people can deliver meals. People are doing all sorts of local community efforts with their frontline responders, volunteering their HCP efforts. So we have a lot of physicians and our staff that actually have volunteered their time to screen COVID patients. And even today on Twitter, you'll see on our Sanofi US channel, our Tennessee plant manufactured hand sanitizer, not only for our own critical employees, but for their local community hospital. So it's things like that that really helped us rally together. Next slide. Just some key learnings. I won't go through all of them, but I think one of the things that I do want to focus on is thinking quickly but rationally. As part of any crisis plan, it's important to have cadence. Everyone wants to have a seat at that table, but really, how do we get communications out quickly and how do we get everything approved? Again, maybe our size adds to that complexity, but if you're in an organization that is large, I would say please try to get that approval cadence early on. It'll help get everything out. Teams to divide and conquer. Shout out to my amazing communications team. I think some of them are on the line, but it's impossible to do and to reach the amount of employees and stakeholders as quickly as you did without dividing and conquering. So definitely have a team you can trust and that could quickly rally. An intranet space so that everything can be in one location. One of the things is everyone wants to shoot an email out. Get an email out, get an email out. But I think one of the best things our leaders can do is have those Zoom verbal touch bases. on the shop floors if they're the critical employees, pulling together people on a phone call, one-on-one touch bases as much as possible. I just don't think that relying on written or email communication is the only way to go in a time of crisis as we're in today. I think the other thing to stress is common sense. How will this communication land? Are we putting people first? Is this the right time to send it? Just having that perspective of how to get a message out to employees and taking a step back to think it through is valuable. And putting people first, like I said, and I think all of the other speakers on the panel said, we introduced HR policies that will help employees feel comfortable. They don't have to worry about their pay or their benefits. It was always our people first, and obviously our patients are second, but first because we're all patients at the end of the day, right? So next slide. Digital communication. So something we haven't talked yet on the line is social media. And in this time of chaos and pandemic, social media is really one of the key ways to get our messaging out. There is no barrier in social media. So we communicate with your everyday person, patients, doctors, nonprofits, government officials, media, all through our social channels, and also our employees. Next slide. So our website served as our one-stop shop. So every single statement, every single press release related to COVID, every single initiative that we did for volunteerism or donations, that was also posted in this resource center. We made sure to pin the statement on our Twitter channel so that people can always find the latest and the greatest. Next. Social media. We took the first step in pausing everything. And you might say, well, wait a minute, you just told us to go really fast. In social media, I think it makes sense to pause and to really take into a perspective and reevaluate not only all the paid promotion that you're doing, but also what you've had in your editorial calendar, because that can all go out the window. Strategic perspective on what and when to say things. For instance, we paused all of our paid promotion. We shifted gears to only put out content that was related to COVID-19, but we had to make sure that it added value to the conversation. We put out daily, multiple times a day content that drove to what we're doing, drove to what was happening around the country, around the world, and how we were giving back in that situation. We wanted to make sure that our organic content and our credible content was reaching everyone that needed to see it. Next slide. So a few takeaways here. Be nimble and quick. We can't go through rounds of weeks of editorial and legal reviews. This isn't that time. It's also not the time to be self-serving. I'm sure there are companies out there, I haven't heard of any in our industry, thank goodness, that would say, oh, well, let's put out a tweet about how, you know, a soda can help you get through the crazy days. That's not the right way to do social media, especially during this time. So we want to add value to the conversation. We don't want to appear tone deaf. We want to make sure that we're spreading credible news with so much overload. The CDC became a great resource for us to share, but we also wanted to share human positive stories that also tie to our business as much as possible. We have nurses, we have doctors, we have therapeutics. We celebrate milestones like National Nurses Week, which is happening this week. We've celebrated World Health Day and Earth Day, but just a slight pivot can have a really large impact. Next slide. So I quickly ran through a lot of topics. I think all of us on the line in a great way have said the very similar things about putting people first, acting fast, making sure we're strategic and transparent. And for social media, I think it's important to really be creative, but also be true to our values as a company. So I look forward to hearing your questions, and thank you so much.
Terrific. Thank you. Thank you so much, Lolita, Nicole, Maricel, and of course, John. Terrific insights and terrific examples, real specific. That was so helpful. I'd like to remind our listeners that if you'd like to ask a question, you can do that on your computer screen. Just type something into the chat box. We did have a question in terms of when the slides will be available, and indeed the slides as well as the recording will be available tomorrow on the BioNJ website at bionj.org. We do have a couple of questions. Actually, this is, I think, a really, critically important one. So, what are some of the best practices to work with employees who are parents of young children? We've been hearing a lot of challenges to balance taking care of children and working. I'm thinking of having employees work 4 days a week, limited hours, but wanted to hear what others are doing to address work-life balance. So anyone want to grab that one? That's an important one.
It's Lolita. I can start. I'm sure others can chime in. I think family and your personal life comes first. I saw a meme earlier that said, we're not working from home, we're working from home during a crisis. And that is a very different thing. So we definitely understand not being able to join certain calls, not being able to email during certain times. We encourage people to take time off as much as they need. Like I mentioned, we introduced an emergency leave policy if you do need to take leave to be with your family. I have 2 young boys that I'm homeschooling at the same time, and right before this call, my dog decided to get sick on the carpet. There's nothing I can do, and there's nowhere to hide. I think for companies to introduce policies that work for them, absolutely, people need to come first. And mental health is also a key initiative that we're supporting across Sanofi, especially with Mental Health Awareness Month this month. We're having a program on that. I would just encourage companies, if 4 days a week works for you, absolutely go for it. An unproductive employee is just not a healthy employee as well.
Thanks, Lolita, for making it real. Hopefully your puppy's okay. Anyone else want to comment on that one?
Yeah, Debbie, this is Nicole. Oh, sorry.
Go ahead, Nicole.
Okay, thanks. Yeah, I echo what Lolita said. In addition, I mean, I think we're looking at it not as a blanket policy. We're going, flexibility is the word here. I think we're going to have to be creative in coming up with what works not only for each individual, but what works in each geography. So we've given and started that dialogue with leaders because it's going to vary depending, and also functional area, depending upon their own personal situation and the nature and the work that they perform. So flexibility for us is that key word. And we've always been a very results-driven organization. So we don't care when you're doing it. It's, put your family first, and whenever is good for you to, to get the work done, that's fine with us. Particularly now where there's a big blurred line, it's not necessarily a 9-to-5 role anymore. I think that helps with the flexibility.
Great, thanks, Nicole. Marisol?
Yeah, I was just gonna add, I think having your employees see that you're also struggling with the work-life balance or having kids at home is good, because it builds a little bit of that flexibility that the other panelists were talking about. So I've had my children walk in on me and be on video with when I'm on calls, and it kind of, breaks. It's a little funny, they introduce themselves, they interrupt me for 2 minutes, but I think it does create that sense of being together through this. So, the fact that my kids are joining my call, for a minute or so, and I introduce them to my team or to another person who I'm speaking with, that kind of also shows that this is what we're all dealing with. It's very real. So, by example, I think that also adds to the fact that employees know that everyone's going to be flexible during this time.
Absolutely, makes sense. And I've heard some wise people say, there's no reason to apologize. Just no reason to apologize if your kids come in camera or your dogs are barking. We all understand it. Prediction, we will all be so much closer, even though ironically we're so far away now. I think we'll all be so much closer after this is all over. We know what each other's houses looks like now, right? So another question, how have you helped leadership through the uncomfortableness of not having all the answers? Saying it and working through it is challenging for everyone.
I can jump in on that, Debbie. And that's one of the things that we've been touching on throughout this webinar is timeliness. And when you have so many constituents and all of them are experiencing the same thing we are, and there's so much uncertainty, some of our leaders aren't very comfortable when they're put in a position where they don't have all the answers. So we do encourage media training, we do encourage rehearsing. Most good crisis plans come with a process for rehearsing different scenarios where it's okay to say, I don't know. And it's okay to let, especially now, you know, in an era where everybody sees your house and they've met your dog on Zoom, it's okay to show some humanness and humility. But again, life science leaders, you know, a lot of them are not wired that way. So I think it comes down to practice.
Makes sense. Okay. Let's see. So anything to help managers identify signs of mental health concerns with their teams and mobilize additional support, substance abuse, depression, anxiety? Anyone?
That's such an important topic. I think today, especially, we have a really great campaign called It's Okay Not to Be Okay. And I think what that says is you have the support and the resources that you need. So in the most tactical way, I think managers need to have daily, weekly, put that video screen on, even though I was joking about my photo, messy bun, who cares? Having that interaction, that human interaction with your teams is important to see how they're doing. I think pointing them to resources that are available. So every week in our weekly newsletter, we put in information about all of the various resources we have available, which are counselors, free sessions with therapists, we have wellness sessions, we have meditation sessions. And not only did we put it in our newsletter, but we also have a portal on our COVID intranet page that has all HR and wellness information. So employees know where to go when they need it.
Great, thank you. Anyone else want to comment there?
I'll just add in something from the perspective of the companies that are represented here. They usually have big, large HR functions, and as a small PR firm, a lot of our clients are smaller, and so they don't have as much resource. And I hear questions along these lines. I haven't heard from so-and-so in research. I haven't heard from so-and-so here or there. I wonder if they're okay. And it's, you know, it's interesting. We have Twitter and Facebook and Zoom and, you know, all these different technologies. And I do want to give every manager the, you know, the option of picking up the phone and just getting into a conversation with your manager. It's okay to ask, how's everything going? Do you need anything? Is everything okay?
Thanks, John. And I think
Debbie, Nicole, you know, I think as I said when I was presenting, one of the first things we lead with is, how are you? I try to start, and we encourage all of our leaders to start their conversations that way, to have the conversation and to not only ask how they are, but to share. If the leader shares how he or she is feeling, is comfortable expressing, you know, I've just balanced a million different things, or I'm feeling stressed out, and this is how I'm coping with it, it makes it easier for the employee on the other end of the phone or the Zoom to express his or her own concerns or frustrations. So I think that's a critical component to it, is to make it okay to have that conversation, is to give them a safe place to share how you're feeling. They're more inclined to give back how you're feeling. And then similarly to Lolita, we have a number of resources that we would then turn around and direct our employees to if they seem to be really struggling.
Great, thank you. We're getting great feedback online. Someone's going to start a gratitude campaign. So here's a question. I think, Lolita, for social media, are you doing a holistic shift in tone, or is it more business as usual?
When COVID really, so in March, when we really went into lockdown mode across the country, or at least here in the tri-state area, we did go into a shift. So all of our content that was not COVID related went to the back burner. We just put it on hold. We found that it would have been tone deaf or insensitive to have discussions about, like, you know, random topics that had nothing to do with what everyone was facing. So that was definitely a shift. From there, and now that we're in May, let's fast forward to May, crazy, we are introducing other content because, like we said, you know, people's asthma or people's rare diseases don't go away just because COVID is here. So people are dealing with multiple health issues, and we find that as a leader in healthcare, we need to be there for them. So we have introduced various programs. We are putting out our trial results for various therapeutics that don't have to do with COVID. And so I think the conversation has definitely shifted, but we are balancing it with thank you messages, messages of how our own efforts for COVID are going, just to keep everyone updated.
Great, thank you. So how do you measure how much, and I can see already that we're not going to get through all the questions, but we do promise that if you've asked a question, we will come back with answers. So how do you measure how much communication is too much, particularly emails? Digital death is always a concern, but you want to ensure that you remain relevant and present to respond to needs.
Yeah, this is Marisol. Maybe I can take that because I think at one point I did feel that we were over communicating, and I had to put a stop on it and say, okay, I really don't think that we need to communicate this week, or, you know, we don't need to do another Friday video message if we really don't have something really substantial or inspiring to say. So I think it's something that you have to really gauge and see if it's needed. But I would also say that employees react differently to various communications channels. So some may actually opt for email, others may opt for video, others will want that push email that comes at the end of the week, or they'll go on the intranet whenever they have 10 minutes. So even though you may feel that you're over communicating, you're just communicating using different communications channels that may be more suitable to some employees than others. So it is something to be careful, but as they say, sometimes over communication, especially in a time of crisis, is better than lack of.
I'll jump in and just say cadence takes on different forms for different audiences, and different audiences get used to a cadence. And thankfully for crises, there's kind of a bell curve. So we don't want to over communicate. We don't want to create fatigue. So that there's a component there where monitoring your different audiences help with the complexity. You know, we talk about the topic of complexity with various audiences. So I hope that helps.
Thank you. And I think maybe we have time for one more question. And I see, and we have so many questions here. I'm just really blown away. We will get you your answers. In the meantime, though, I would have to go to patients. There's a question about patients. So how are you working with your patient advocacy groups? How are you, any best practices on working with them to manage patient expectations and ensure safe access to care?
I can take this one. I mean, we have, it's Nicole. I spoke about the patients before. You know, we're continuing to make sure that we understand what's at the minds and the forefront of our patient community so that we can address it either through our patient support program or in support of the patient advocacy organizations if there's other information that our patients are needing. we're making sure that we have it readily available. I mean, it's always been, it's a partnership in making sure that we can support them with information that's relevant for the disease state area. And, you know, now that most of our, or all of our MSL team is home, we have, you know, individuals that can help pull people. We're trying to use their expertise in different ways, pivoting more to do some more writing versus the outward face-to-face communication that may have otherwise typically occurred.
Great. Thank you, Nicole. Anyone else want to comment on that one before we close? Okay. So we will wrap up now. I'd like to thank you again, John, Marisol, Nicole, Lolita, for sharing your time, expertise, and support. Truly appreciated. We're honored to have JFK Communications, GenMed, InsMed, and Sanofi as valued BioNJ members. As we mentioned, recording of this webinar will be available tomorrow. I'd like to thank you all for joining us. We will get back to those who had questions. I promise that. If you're interested in learning more about the benefits of BioNJ or sponsoring a webinar, please contact Kim Minton. We hope that you'll join us for 2 upcoming webinars. May 20th, there's one on tips and tools on NCATS, SBIR, and STTR funding, how to successfully apply. And on June 3rd, the value of medical innovation in the age of COVID-19, ensuring future cures and protecting patient access. So again, thank you for joining. We wish you the very best of health to continue. Please take care.